The ABA therapy process. Your therapist will help you to decide on a plan for your child's ABA therapy sessions, including goals and session length. The therapist will start with an assessment to look at your child's medical history and previous treatments. Your family members will be interviewed to find out more about their goals for treatment. The therapist will also observe your child during an initial session and continue to evaluate your child's progress towards goals on a regular basis. ABA therapy can be done in a number of different settings, including the home, school, inpatient programs, and places in the community. Parents are also trained to help provide support for the child in different environments. The number of therapy hours will depend on the goals for treatment. ABA treatment usually takes about 10 to 25 hours per week. Some programs for severe behaviors need more hours. ABA treatment can cost $125 per hour for a certified ABA therapist. Check with your insurance company to see if the cost is covered. Some states require that insurers cover ABA therapy. Children are usually evaluated every few months to help determine how long treatment should continue. Usually, the program will have a gradual step down in services before the therapy ends. When to stop ABA therapy? According to the Council of Autism Service Providers, ABA therapy should be reviewed or stopped in the following instances. The patient has met their goals in the program. The patient does not meet the criteria for autism. The patient is not showing any progress in the program over time. The family and provider are unable to resolve important issues related to the treatment plan. ABA can be helpful for some autistic children, but it may not be the right therapy for your child. Talk to your child's provider or therapist about any concerns you have. They can help your child transition to another treatment if needed. Why is ABA therapy criticized in the autistic community? ABA is not without controversy. Many autistic adults who had ABA therapy as children say that the treatment is harmful. Some describe ABA as compliance training that forces children to ignore their instincts. The negative effects of ABA might be lasting. A 2019 study found that people who underwent ABA therapy were 86% more likely to meet the diagnostic criteria for post-traumatic stress disorder. How many hours of ABA therapy does an autistic child need? ABA therapy is time-intensive. While the specific therapy changes from child to child, the number of therapy hours typically ranges from 10 to 25 hours a week. Your child's therapist will reevaluate every few months to determine how long therapy should continue.